Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good evening. It's exactly 18 minutes past 8 o'clock. My name is Faisal Kassim and welcome to the live Real Talk. And tonight, I'm honored to have one man whom I learned one important thing from on Tuesday. We were at a signing ceremony between Jamia Mosque and Avenue Hospital, where Jamia Mosque has trusted Avenue Healthcare enough to bring them on board as their primary healthcare provider within Jamia Mosque, for its staff and all the members. So Imran, I was just about to say the favorite. So Imran said that there is a perception, there is a notion that healthcare in this country is expensive. He said no, it's not as expensive as it looks. You just need to plan. With better planning, healthcare can be one of the most manageable sectors in this country. Ladies and gentlemen, tonight we are honored to have the CEO himself, Mr. Imran Osman of Avenue Healthcare. Assalamu alaikum, Mr. Imran.
Wa alaikum salam.
How are you doing, sir?
Alhamdulillah.
For real, I meant it. Usually when you said it in your speech, I was moved by that. You said that healthcare is not
expensive. Yeah, it's a myth. And you know, what people perceive healthcare as expensive is really a health-seeking behavior. Many people tend to wait for the last minute to look at that wound that is burning, that pain that is not going away, that headache that it's been lingering for a while, that limp or a panting of climbing stairs. You wait until you can't climb those stairs. But by doing that, you're actually postponing a problem. And what we're doing at Avenue is particularly ensuring that we focus on preventive health and changing the health-seeking behavior of Kenyans and particularly our Muslim community. There are lifestyle diseases that we go through, and because of our lifestyle, because of lack of exercise, and even the transformation that we're going through in our lives, we tend to neglect health.
They always say that you're one admission away from poverty.
Yes.
I mean, because you've seen the medical appeals, I'm sure you've come across many. So-and-so has been admitted, or 4 million for her to be discharged, such and such has been admitted, we have such and such case. Some cases that are appearing to be horrendous, to be like a movie, to be theatrical. You're like, subhanAllah, how can such a thing happen in this country?
Correct,
right? Yet we're paying taxes. Yet we're seeing all these things happening. So first, the general healthcare system in this country has been a problem. First, it was under the national government. We saw the doctors striking, we saw the public healthcare system has been a problem. Right now it has been devolved, but still it's not fixing the problem. We're still seeing cases in the news outlets. We're reporting cases, right, of mistreatments of patients. The general healthcare system in this country, it's still not at its best. As Avenue Healthcare, much as you guys are in the private sector, beyond the preventive side of it, what difference are you bringing into the healthcare system to try and get Kenyans and everybody who's living in this country a better health care management system?
That's an excellent question. I think what we're lacking in Kenya particularly is trust. It's not really about the services not being there. The last stats I looked at, 97% of those Kenyans who feel like they require tertiary care go abroad, go to India, 97%. And majority of those who go out are either cardiology patients, oncology patients who are seeking further treatment, and that treatment is available in Kenya. In Avenue particularly, we've started all these services. But what really comes down to why we're lacking trust is transparency. The physical the information disclosure to the patient from time to time is something that is not clear in the healthcare system. You come to get admitted, or you come at the outpatient and suddenly you're told, go to the lab, go to the pharmacy, take these drugs, but you're not understanding. And the other perception that we have is Dr. Google, and everybody is comparing notes. But what we've done in Avenue is particularly we have built an infrastructure that, number one, patient rights are extremely important. Integrity is one of the key pillars in our mission and vision. We're also looking at quality of healthcare. Now, why are we different in particular? We provide continuum of care. What do I mean by that? Avenue Hospital perhaps is the only one in Kenya, or maybe even in Africa, I don't know. But arguably we provide preventive care, which is prepaid. You can save for health, and you can be guided on how to save for health. The second level of continuum of care is primary health care, which is now going right to the grassroots and providing access to healthcare at the primary level, the communicable diseases through clinics. So we have 17 clinics across the country. We're expanding another one. In fact, we're opening one tomorrow evening at Junction Mall.
Really? Nice.
So that's primary, from prepaid to primary. And then we have secondary healthcare, which is through our hospitals in Kisumu and Thika. And we have tertiary hospital in Parklands. But we don't stop there as Avenue. We have quaternary care in Kenya with colongioscopy and endoscopy procedures, who we're probably the only ones doing certain procedures there. And we can refer patients to our network of hospitals across the globe. We are part of Evercare, which has hospitals in India. We have hospitals in Lahore, Pakistan. We have hospitals in Lekki.
Really?
So we are a very big outfit per se. We have over 16 odd hospitals which are providing tertiary and quaternary care hospitals.
So basically what you're trying to say is that if I pick, for example, Avenue Healthcare or Avenue Hospitals as my primary healthcare provider, and it appears or it happens that I need a referral or I need to be checked, as you've said, 97% of people or of patients, they seek healthcare services abroad, right? So in such a case then, with your networks, so you see, or you mean rather, it's going to be just from, it's going to happen like a transfer from one facility to another.
Exactly. So how do we bring cost of care down? So we transfer patients from one level to the next level. And apart from the quaternary care and tertiary care that I mentioned, those are specialized care, which requires heavy equipment and heavy specialization. We also have home-based care. So Avenue has an home-based arm, which we can discharge the patient to home-based care. We can provide palliative care at home, elderly care at home, and also lease equipments. So you don't have to buy, let's say you're discharged, you need a wheelchair for 3 months or crutches for 3 months, or you need a ventilator at home. We can lease that to make sure that you don't pay for that. But you mentioned a good point where continuum of care is actually, many people when they get transferred from one facility to the next, literally they start the care again.
A new process, you know, like you're admitted in one facility and then I am a victim, you know. At some point we were admitted at a particular hospital, right? And we felt like, okay, so this hospital could not cater to our needs. They were not understanding us. They were not looking at what we were looking at from that perspective, or rather we could not get the best services at that particular facility. So you can imagine talking to the insurance provider, discharging here, and then talking to the other hospital or to the other facility and trying to start the whole process afresh. I mean, it was, I cannot say cumbersome, but again, it was so eventful. Too much at the same time.
So you need to look at continuum of care in the sense that there's a handing over to the next level. So you come to a clinic and you're seen by a medical officer who is equipped to treat certain level of diseases to a certain level of what his qualifications are. But then if it's a gynae problem or a surgical issue that you need an intervention, then he refers to a specialist who is on board, and if you require in the clinic, you'll get the specialist. But then when you get to a hospital, and this is a personal experience that I've seen, and this is why the passion in healthcare has come. I've had situations where some of our relatives have gone to, say, India, or gone to another hospital that is far superior from where they were, from a town, say, Eldoret, coming to Nairobi. And that medical record that they had they've come with is either, we're told, no, keep that aside, or it's thrown to the bin, and you start your lab test, you start your X-ray, you start your MRI afresh. Now, what that does is, because of those disconnects, you tend to restart your care at every stage. So you pay probably triple or quadruple, because the lab test that you did, say, in a small facility anywhere in the country,
you have to redo it again.
You have to redo, because that doctor isn't sure about that test, or would like to see, because he's sure about his lab. And then the handover of patient, because we record digitally all the records. Even the CT scan and MRI are also digitally saved. So you come to a facility in any of our network, they will just retrieve your document and say, okay, this is where I can see your history was, and I can now continue from there because I have your history.
So this is a continuation.
Continuity of care, right. So what we're trying to now build is a chronic care program and also a patient app. The chronic care program is such that we have seen it targets the diabetics and the hypertension patients, and both. And through the study, and we've conducted this study for over a year now, we've actually realized that the cost of care of an average diabetic hypertension patient is roughly about 220,000 Kenya shillings. That includes medication, that includes visits to the hospital, physiotherapy, eye check, and so on. If somebody is doing that correctly. What Avenue has done innovatively, we have been able to now create a product in the market with a view of bringing affordability and continuum of care. We have brought that cost down by roughly about 45%.
No.
So we have packages of chronic care that go up to about 120, 140, depending on what kind of package you choose. But what that means is, it's not just about the package, it's about your lifestyle. So we have seen diabetes 2 get reversed because of this intervention. So many people tend to, because they are not covered or they are not part of a program, they miss certain medication, they are not checking their weight, they are not checking their meal, they are not walking. So it's a lifestyle. So in the chronic care program, what Avenue has done is, we call the patients every so often. We monitor the patient every so often through telemedicine. So somebody will call you and check on you probably every Monday or every Wednesday and tell you, okay, sir, you are on diabetic medication. Did you take your medication? Have you had enough water? Did you have a 20 minutes brisk walk? Your next appointment for ophthalmology eye check is due. You've been booked for an appointment. So it forces a change in lifestyle. And
so you don't have to do it yourself and keep track.
Absolutely.
Somebody's doing it for you.
Somebody's doing it for you. And you know, the Kenyans we are, like, many of us filed our taxes at the end on 30th and we also wait for when elections happens. Generally people go to the line at about 5 because the poll station is closing at 6. Yet in the morning you'll find the poll stations empty.
True.
So when
last minute people.
Exactly. So when you have somebody chasing up to you and asking you constantly, because they want literally for you to reduce your medication and reverse diabetes, that's the objective. It changes lifestyle, and I have my uncle enrolled in it, who actually complements this. In fact, initially, and I say this with all due respect, my aunt was like, these people keep calling us, you know, every third day they are calling, but that meant that every morning my uncle now is walking the compound. Previously he was not that disciplined.
Following the routine and all that,
but the other thing that people tend to miss out in diabetes, for example, is eye checks, foot hygiene, because once you get a wound in diabetic, it tends to get very nasty and sometimes even amputation. So if you don't take care of a growth or a wound properly in diabetic, you don't heal properly. So this check, and you know, you can just dial a number and call, and that doctor is online for you, and 24/7 they're there to help you manage your care. So because then you don't worry about the money part of it, you're just focused about, how do I get better? How do I manage and live a healthy lifestyle despite you being a diabetic or hypertension? Not only that, there are other products for lifestyle diseases that we've developed, package pricing in the hospital. So
the bazoo, like for
Yeah.
example, for the men, I've seen the different packages and how you guys have been so innovative, trying to come up with different names, you know, just names that relate. Like for example, the bazoo wellness package.
So
I mean, it's interesting how Avenue thought of the boy child and thought of the men.
Yeah.
Everybody will think of the girls. Everybody will think about the expecting mother. Everybody would think about cervical cancer and how to prevent cervical cancer. People will think about the kids, for example, you know, the clinics and all that. Interestingly, the first hospital I've seen with this package, and Wallah, I'm not saying this because you're on this show, but I saw it at the hospital and I was impressed.
No, so we have a team. So how did Avenue start? Let's begin from there. Avenue started from a doctor called Dr. Patel in 1970s. Dr. Patel just qualified and decided to get onto the bandwagon and join the medical fraternity. But he realized that after a while that, you know, the people who are coming to the hospital are those people who can afford, and it was also at those years segregated. There were people who could and those who couldn't. And he felt, no, I'm not serving the purpose I want to. He decided to open a clinic in his house on First Avenue Parklands. And that's where Avenue Parklands began. So it's on
where Avenue is located right now.
I mean, it started from there, and he started in his house. He had a maisonette. He opened up a clinic in his house at the front yard, and the clinic got traction because it was about affordability and accessibility, and people would come and seek that medication that they need or attention they need. Beyond that, what happened then is the clinic got so busy that he then had to convert it to a maternity home, and then set up a theater, and then set up a nursing home, which is what we were known for a long time. And we call ourselves a sleeping giant. Right now, what we've done is we have 3 hospitals, 17 clinics, and expanding. But what is the important note there? The ethos of Avenue is affordability, and that's what we're driving. So the team, whenever there's an induction of a new staff, or even when I joined, the discussion was, whatever you're bringing to the table as an idea, how do we make it better, more affordable? Yes, as I said, healthcare can be perceived as a myth, as expensive. But because we delay things, and what you pointed out, we are one admission from poverty. Every day, our hospital managers tend to sit with parents and relatives about a harambe because you know, a patient has gone beyond expectation, the bill has gone beyond expectation, and how do you counsel them to manage the outcome? But it doesn't. You don't have to wait to get to that level. And this is why the wellness packages were developed. Honestly, we're not the only ones, but the innovativeness that the team has brought into these packages of wellness for men, wellness for women, wellness for teenagers, wellness for chronic care patient, and so on.
And the different levels and packages and offers that comes with different.
Yeah, and because of our model of how we are structured, we are very lean. Today we've opened up 75 parking slots in Parklands instead of putting up a big tower, because we want to optimize the current space that exists. Eventually we will expand, but we expand because when the demand rises, then we go on. And the lean structure is such that we are focusing on minimal invasive surgeries that require you have a shorter length of stay, better outcomes, and then you can be discharged if you like to a home-based care facility. So that shortens your runway.
Which is quality oriented.
Yes.
Thank you so much. I wanted to hold it there because I have a witness who said that, and he testified, Juicy. He said that when it was time for him to be discharged, he asked his family to slow down the front. I wanted to hold it there because you are due for a fast break right here on Live Real Talk. I mean, guys, can never be better. We are learning about Avenue Healthcare. As they say, it's all about efficiency and affordability. How can it be affordable for you, the viewer, back at home? Check them out right now. Check them out on www.avenuehealthcare.com, right?
Yes.
Yes, check them out right now. as we are going on a very short break. But please don't you touch that remote, because we're going to be back in a moment.
Horizon TV, the beacon for the nation. Verse of the day.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم.
وعباد الرحمن الذين يمشون على الأرض هونا وإذا خاطبهم الجاهلون قالوا سلاما والذين يبيتون لربهم سجدا وقياما والذين يقولون ربنا اصرف عنا عذاب جهنم إن عذابها كان غراما إنها ساءت مستقرا ومقاما.
Wakati nilisilimu, hiyo picha iliweka kwenye YouTube. So walipatana kule, nikapigiwa simu, nikauliza, kuna video tunaona, je ni wewe?
Ilinipa moyo. Siku give up. Msimu anavyosema Allah maswabirin. Mamangu haya kujela elimu kwangu ilikuwa inanisaidia kidogo. Mwambia mama sijishughulishe, maana ifikia nataka kuuza kile kitu kwa usafiri wake kuja.
Sasa ilikuwa vita kwa kanisa, vita huko nje. Kwa kanisa unapigwa vita kwa president worship, mara unaimba kujionyesha, mara sijui nini. Yani there was no a single day that will pass without me not crying. And on Friday in the morning, very early in the morning, I woke up and I told God, this is the decision that I've made, and please walk me through. And let me never come back to that life that I've been living.
At some point she told me, kama huachi dini, I'm going to disown you, na nizae mtoto mwingine na nimpe jina yako and I forget you. Wewe uendelee na hiyo dini. That hurt me.
أعوذ بالله من الشيطان الرجيم. يا أيها الذين آمنوا إذا نودي للصلاة من يوم الجمعة فاسعوا إلى ذكر الله وذروا البيع ذلكم خير لكم إن كنتم تعلمون.
Enyi mlioamini, munapoitwa kuhudhuria swala ya Ijumaa, fanyeni haraka kuikimbilia, muache biashara zenu, hilo ni bora ikiwa mwelewa.
Isikilizeni kwa umakinifu khutba ya Ijumaa
ili uzidi kujenga imani yako na kupata faida nyingi ya siku hii.
Coming to you every Friday from Jamia Mosque, Nairobi.
Live on Horizon TV.
Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. I am so comfortable right now because despite my tummy and despite having diabetes in our lineage, I know with Avenue Healthcare I am safe. I'm going to be that person who is going to break that spell because I'm right here inside the studio with Mr. Imran Osman, who is the CEO of Avenue Healthcare, and sharing with us amazing packages about the Avenue Healthcare. Mr. Imran, subhanallah, I have to stop myself from calling you Doctor. Literally, you know how many times, every time I'm just about to say your name in my head, I'm already processing Doctor. I'm like, wait, it's Mr. Imran.
No, I get that a lot, and one time I was telling myself that I need to get a doctorate,
yes,
to formalize it. But at the same time, you tend to worry when you work in an industry, being an accountant by profession, being in the industry of health over 18 years now,
wow,
alhamdulillah. But more importantly, when somebody faints, let's say, God forbid, in a supermarket, and they know you're in a hospital, then Daktari, please run and come and save. But as essential as it is, when you work in healthcare industry, yes, we are required to do some basic stuff, like basic life support training. Is a requirement, first aid training, which is part of basic life support. But and then for the clinicians, then you go advanced life support, and those basic minimum are ingrained in us over the years. So so I've been going through a few courses, but I'm not a Daktari.
But at least you're well versed with the wellness packages that you're just telling us about. Yeah. How it all started with Dr. Patel and coming up with the hospital and all that, and then the wellness packages were introduced.
Yes, so where we left off was the wellness package covers all sorts of age groups. You're looking at gender and lifestyle diseases. At the same time, we're looking at male and female and different age groups. So for example, for male, once you turn 40, then you need to start taking care of your health. You need to start earlier, but now it becomes even more critical because you need to get a prostate check, you need to get your examinations done as a health, your body mass index and so on. For women, then there's a special product for it, and I would encourage people to visit the website. All the products are on the website, and you'll see how they are competitively priced. But more importantly, it actually gives you a startup towards living a healthy life going forward.
Interesting. Dr. Juzi, on Tuesday, you signed, sorry, Mr. Imran. On Tuesday, you signed an MOU,
yes,
with Jamia Mosque. Jamia Mosque decided to take you as a primary healthcare provider for its 200 staff for the Jamia Mosque. And I am a witness, as a staff of Jamia Mosque and one of the senior staff, I actively took part in the treatment process of at least 3. 1 who is an active staff and 2 who are the spouses, just the beneficiaries of this cover. And you've dubbed it Shifaa cover. Can you just tell us more about this Shifaa cover? And is it only meant for Jamia Mosque, or how does it work?
No, so we went back to the drawing board as a team, and when we scanned through the market, what we felt, how are we going to make a difference to people? And being a Muslim by faith, I also felt that our Muslim communities are not adequately insured for many reasons. One is affordability, secondly is postponement, and number 3 is because there is a belief system where insurance is haram in some context, right? So how do we then, majority of our Muslims, I would say 98%, and this is my guesstimate, 98% of Muslims are probably not covered by any insurance, okay? And out of those 2% or 3% who are covered by insurance are either because they are employed, and through their employer they are covered, or because they've decided to choose a lifestyle of being covered. They're coming from abroad or lived outside, or their children are paying for their cover. But what happens to the rest? We tend to save for a vehicle, to buy a car. We tend to save to buy a house. Investments. We tend to save for weddings, harusi kubwa, tunataka walima, tunataka nini, we save. But rarely do you find somebody saving for health. Okay? So what we did is we entered into a discussion with the Jamia Mosque, and what better team to start this discussion with. And we said, look, I am a Muslim by faith, however my team and I would like to discuss with us. We've come up with some ideas on how to cover the Muslim population and the outside Muslim population, because it's not limited to Muslim. We've come up with this product. Could you test it for a couple of months and let's on board. For 7 months, Jamia has been onboarded in this scheme. It's called Shifaa Medical coverage. It basically follows the principle of Sharia. It's about saving for health, and the way it operates is you pay that amount over a period, save, but then if you don't spend it, you can carry it forward. So you don't lose the fund. You continue to carry it forward, and then what we've done is we've come up with probably about 7 types of covers that you can design the way you want. So now imagine you at home and you're sitting in your living room, you're in an apartment building in 3rd floor, and there are 30 houses next to you, up, down, and overall. Those houses have different kind of people. They have an age of youngest, maybe a toddler or a newborn. You have a mother, you have a teenager, you have a child who is about 10 years, and you have the father, and you have an elderly. And most of us in the Muslim community live in extended families.
True.
So how do you then design a cover for yourself? But then it doesn't stop with you as a family. You decide all these apartments have a management committee. This management committee then has a team who can sit down with you in Avenue and say, okay, this is your population demographic. We are going to design a cover package for you that fits, because we've been in the industry for over 45 years, and we've been doing this for roughly, designing covers for roughly 28 years. So we have many types of covers that we can design for you. So if you say, I have majority of my population is elderly, then we will design an elderly package for you, which you're looking at chronic care and so on. If you have a teenage, then the wellness packages come in. If you need a cover that requires optical, dental, and so on, or you require only inpatient, then what do we do? We start saving for health. You start deciding, we come up into an agreement and set you up and tell you, we'll give you the administration control, but we will help you manage. Now with Jamia, what we've done is we've signed up the 200 plus staff, I think 217, and those staff have dependents. And we have clinics across the country that they can access to both in and out, and the continuum of care comes to play. But the add-ons there are not, it's to help Jamia save. Why? Because they were spending X amount of money in healthcare, and now they are spending Y, which they've seen the benefits of reduction of cost. But it's not reduction of cost because of only affordability. It's reduction of cost because we are engaging into giving statistics and information to the Jamia management and the staff. There were this many admissions in, let's say, upper respiratory illness, or there was cholera in many of your patients, or there was this type of disease, or we are seeing this kind of checks that are coming, the trends, and we need you to intervene either. So in one of the examples is we had patients coming for physiotherapy, and they were referred to physio, but the goal, the root cause of that is because of how they were sitting in their office. How they were, for the workers who are cleaners, what kind of brooms they're using, how often do they stretch. For the cholera, it's about what kind of sanitation are they, the measures do they need to put. Hand washing is a basic one, and we do wudu, mashallah. But at home, how is your lifestyle? What kind of water do you know how to treat? So Shifaa goes beyond. The word Shifaa is about getting better. It's about getting well, and it's about you saving for health to avoid and to beat that myth of healthcare being expensive, so that when you do need that intervention, you have enough reserve for yourself and for your family, and you manage the scheme on your own.
That it won't be an emergency at that time.
It won't be an emergency at that time.
Makes sense.
Yeah. And because of the continuum of care, therefore, we can help you navigate through pre, post, home-based care and all the spectrum within that I mentioned. And we're able to conduct health talks with you, with your estates at home, with your families at home. Even in weddings, if you'd like us to come for health talks, we can, because that's where people don't miss.
Yeah,
I mean, I was in a few weddings this weekend, and mashallah, people were eating what we call jalebi,
jalebi, I love that sweet. And gulab jamun.
The most people who are eating the jalebi were those who are diabetic. So we need to manage the care of the patient, but still maintain their lifestyle, and that's where Shifaa now comes in.
Doc, we are, as Muslims, we are one of the most unhealthy communities, right? As I was telling you during the break, there was a time we were walking in one of the streets in Isli, and within 100 to 150 meters, we could literally count 12 pharmacies.
Wow,
12 pharmacies.
Yeah.
Then a list of 100 to 150.
Yeah.
No, I mean, so this is a thing. Look at any, right now, mashallah, our Muslims are really putting up buildings and structures, and look at these buildings. I don't know the right figures, but can roughly estimate 70 to 80% of them, the shops downstairs, they have a pharmacy. Right?
No, it's so true. I mean,
so we are technically an unhealthy community, particularly the lifestyle diseases, the diabetes and the pressure, the HPVs, and the cardiology problems, right? So we are really having some of these lifestyle diseases. Under this Shifaa cover, is there a guarantee that you're going to take us through the journey and work it out?
So yes, and it is true that as a community, but it's not limited to the Muslims. As a community, even in Kenya, the statistics show with the lifestyle changes that we are going through, the kind of food we are eating a lot of processed food, and therefore it's bound to hit somewhere. Our children don't go out to play like we used to in those days. We used to be asked to come home. These days we are pushing the kids to go out, right? Yeah. So that is bound to change that lifestyle. And yes, we were just speaking at the break, and where there are so many pharmacies, but generally what happens is we hand down our drugs, So diclofenac yangu unapatia baba yako, ndugu yako, or your aunt, or their medications, and I see many times in groups posting in WhatsApp that there are this medication that I had bought from India, they are near expiring, does anybody need them?
Oh yes, so true.
It's very common. But to answer your question, yes, Shifaa is how you design. It's literally we are giving the power of designing of what cover you would like as a patient or as a family, as a community. What would you like to see in Shifaa? We have templates. We'll give you direction, we'll give you guidance depending on the demographic and the diseases that we see within the community.
That's after the assessment of my body and my health. Yes.
But then when you design, we'll then put for you mechanisms on authorization, who authorizes in your community. Maybe it's a management committee, or it's an elderly person who is at home and he can get busy in managing a health scheme. Can you imagine that? And in the back door, we are able to manage the scheme that is not abused. And yes, chronic care is covered, depending on if you want it to be part of it. It's even hypertension is also covered. And I would encourage people to really inquire about the chronic care, particularly because I've seen it impact lives and impact changes in reversing diabetes too, for example. But more importantly, in the healthcare field, what you need to understand is in the Shifaa, you can carry forward your balance. You don't lose it.
It doesn't expire.
So let's say you saved
time bound?
No, it's not. Yes, there are administrative fee to manage the scheme when we come into discussion with the community and the families. So if there are 30 apartments that you want, we can design a scheme for you. You save, let's say, through your service charge, 20,000 per month, and you start building that fund. End of the year, you have only utilized, you've accumulated say 200,000, but you've only utilized 20,000. Alhamdulillah, you carry forward the rest in the next year. So every year if you continue to save and save, when that one, let's say unfortunate incident happens and you need to be admitted because of an accident, and in the cover maybe the dental was not covered, but because of the accident there's an impact on your dentures, and you need that surgery, then the management committee will be asked, do we allow this? And they'll say yes or no. Most likely they'll say yes. Or there's an elderly who is climbing the stairs and he's fallen, but you didn't have in your cover an inpatient. You immediately swap and say, no, I would like my fund to be channeled to Mzee Juma because he's fallen and he's our elderly. We would like him to utilize the fund. And you have a voting system within, you can decide. But then what that means is then the Harambes have already been done earlier in smaller bits. A fund has been
pre-Harambe.
It's pre-Harambe and it's lighter. We all give sadaqah, we all save, but as Muslims, our lifestyle, you know, our faith actually directs us to fast. There are reasons why we do that. We are told only 2/3 of your belly should be full, and 1/3 should be empty. 1/3 with food, 1/3 with water, and 1/3 with air, so you can digest. And really, to be honest, in the medical field, I'm not a medic, but as a profession, but I see these practices applied in nature. You're told do fasting blood sugar. Yes, you get the right sugar, but you're also told intermittent fasting. But that's fasting, it's kufunga Ramadan, kufunga saum, right? It's intermittent fasting, and you reduce your weight. So a lot of our principles are designed that way. But ultimately, yes, we do. Our bodies tend to grow older. We are exposed to many diseases, and we need to have a predictable system of when that happens, then Shifaa Medical cover is there.
It's always there
for you. Yes.
Shifaa Medical cover.
Medical coverage, yes.
And we can get the information in any of your outlets.
Absolutely, yes.
And all the branches are listed on your website.
Yes.
Always available.
Yes.
I mean, I can attest you're always available because I've seen I've seen the number of emails we exchange with an amazing team from your side, like Doreen and Davy.
Yes.
Basically need to acknowledge and appreciate the role that our HR manager, Mr. Imran Osman, has played to make this a reality. And thank you so much. Imran, your parting shot, because I mean, subhanAllah, we are literally running out of time. We've run out of time. We're overriding it. Because tomorrow again in the morning, during the Muslim Insight from 8 to 9 with Nadia Osman, we're going to continue the conversation on Shifaa Medical cover. So we have not yet exhausted. We actually just touched on the tip of the iceberg. We are yet to see the rest. So inshallah, tomorrow from 8 to 9, I think David is going to be here.
David and Dr. Said.
And Dr. Said are going to be here, right?
Yes.
And they're going to tell you way much more about the Shifaa Medical cover. But again, Imran, your parting shot.
No, Jazakallah to the community and especially to the Jamia Mosque in helping us develop such a product that really personally it speaks to me from a faith perspective, but it also speaks to me from a healthcare worker who wants to make a difference in the lives of people, to bring in affordability and especially wellness to the community. And I encourage you to try this product, but also inquire, question, help us develop it more, help us to make it better as we go along in this journey of creating cover for health across the country. Yeah. Jazakallah.
Thank you. They say there are things that when they happen to you or someone who is closer to you, then anytime they're spoken around you, they're going to have a different impact. They're going to hit differently. As we say on the streets, they're going to slap differently. I've seen the impact of Shifaa Medical cover. I've seen people suffering, and I've seen people who were in destitute and desperate situations, and because of this cover, alhamdulillah, right now they're back to work and they're smiling. My family and I are signed up for the Shifaa Medical cover. What are you waiting for? My name is Faisal Kassim, and this has been the live Real Talk. It was an honor, my palm-pleasing pleasure to host Imran Osman from the Avenue Healthcare and oozing a lot of wisdom right here tonight on the set. Tomorrow morning, as I've told you, if you want to know way much more about Shifaa Medical Cover, first check out their website, www.avenuehealthcare.com. And tomorrow morning, tune in for Muslim Insight as Nadia will be interviewing Mr. David and Daktari to talk way much more about Shifaa Medical Cover. See you next week, same place, same time. My name is Faisal Kassim. Assalamu alaikum wa rahmatullahi wa barakatuh.
Horizon TV, the beacon for the nation.